Welcome to Pursuing Quality Long-Term Care, an educational podcast for individuals needing long-term care and their families. Join us as we talk with national experts and advocates about strategies you can use in the pursuit of quality long-term care. This podcast is a program of the National Consumer Voice for Quality Long-Term Care. Consumer Voice is a nonprofit organization and depends on our members and donors for support. To contribute to this podcast and our work, make a donation at theconsumervoice.org/donate. Every dollar helps. In this episode, we're joined by three advocates who have worked to raise the personal needs allowance and improve the quality of life for nursing home residents in their states. The personal needs allowance, which is also known as PNA, is a small portion of income that Medicaid nursing home residents can keep each month to cover personal expenses such as clothing, snacks, cell phone bills, and other essentials that make life more comfortable. The federal minimum PNA has not been raised since 1987 and remains just $30 a month, less than $1 a day. While states can set higher amounts, they currently range from $30 to $200 a month, leaving most residents with only $2 to $3 per day for discretionary spending. Join us as we hear from Bill Lamb, a lifelong advocate in North Carolina, along with resident advocates Ray DiFrancesco of New Jersey and Jeanette Martinez of Connecticut, as they share their experiences raising the PNA in their states and their advice for others working toward the same goal.
Hi, everyone. I'm Jocelyn Bogdan, and we are here today on our podcast to talk about the personal needs allowance. The personal needs allowance, which we're going to refer to as the PNA, was established by the Social Security Act amendments in 1972. It is a small amount of money that Medicaid-covered nursing home residents retain from their income each month to cover personal expenses not included in the cost of their care. The remainder of their income goes towards the cost of their care at the facility. And so these expenses that the PNA is spent on include various personal items, and we're going to talk more about what that is in a minute. For many people living in nursing homes, this PNA, this allowance, is their only source of discretionary income. Currently, the federal minimum PNA amount is set at $30, which is less than $1 a day. Those states are permitted, and many states have increased their PNAs as they see fit. We're so happy today to be joined by Bill, Jeanette, and Ray. All three have done wonderful work in their own states to raise their PNA amounts. Bill in his role as an advocate, and Jeanette and Ray as advocates who currently live in long-term care. Thank you all so much for joining us today. Let's talk a little bit about what the personal needs allowance is, what it means to people living in long-term care. I know I just gave a very brief definition, but I really want to turn it over to all of you to talk about what it is and why it's really important to long-term care residents. And anyone can start.
I think first and foremost, the PNA is extremely important to residents because it still gives them a sense of ownership. It gives them a sense of independence. It gives them a sense of just feeling like a regular human being and not being someone who unfortunately has to live in a long-term care setting. It gives them a little more sense of freedom as an individual.
Yeah, I think there's a lot of misconceptions about PNA. You know, when people move into a nursing home, you give up, if you had a pension, all your Social Security goes away. So all you're stuck with is whatever your PNA is, and it has to cover a lot. And I think a lot of people out there think everything we get in a nursing home is taken care of for us. Well, when you really find out what isn't covered, and also the quality of some of the things we get, then that really exemplifies how important a higher PNA is important to us.
Completely.
I would reiterate that. I think the common assumption is that for people living in a nursing home whose care is covered by Medicaid, is that it's all inclusive. It covers everything. And the reality is, no, it doesn't. That there's lots of things that the assumption is that the person is going to be responsible, and that could go from everything from your clothing to personal grooming items, if you have a real preference on the kind of shampoo you want, or any of those, the small items that you just take for granted when you're living independently.
Yeah.
Yeah, and I want to reiterate, Ray, something you said. I think another common misconception I think to a lot of people out there in the world is that this isn't going to apply to them. They don't really see themselves if they have savings as someday ending up in a Medicaid in a facility, but most people end up spending down their money and then do end up on Medicaid and are in a situation where they are relying on this PNA. So this isn't really just a problem of someone who didn't have any money in their lifetime or who didn't have a job in their lifetime. This really applies to most people who end up in nursing facilities at some point. So it's a really widespread issue.
Yeah, and I think one thing, Stacy, who is one of the people who works on the New Jersey effort, she said, I worked every day I could. And then all of a sudden I had an accident and I lived in a long-term care facility. And I went from being incredibly productive and always having money since you started working, very early on, to basically feeling like you're living in poverty.
Right.
Yeah.
So it's really demoralizing too. It's not just the dollars we're talking about, it's the psychological impact and the value that, we lose so much when we come into a nursing home and we get so little control that having a few bucks here or there to spend on even Chinese food, if that's what you feel like, means a lot.
Sure. Yeah. Go ahead, Jeanette. Sorry.
Or even your basic cup of coffee, or even like a candy bar or something like that. Because you're so limited, there's such a sense of, can I really afford to treat myself to do this? And when you've worked your whole life to do something and it comes down to you don't even feel like you can justify purchasing a candy bar for yourself. I really think the world at large does not understand that concept.
Right.
Yeah, and so the next question I was going to ask really is, and you've answered it a little bit already, but what do people tend to use the money for? We're talking about in states anywhere from there are 2 states that are still sitting at $30. There's one state, Alaska, that is at $200, but most states in the country, half of the states provide less than $60 a day. So when I was a day, oh my goodness, I spend like $60 a month, which is less than $2 a day. So what do people need to spend this money on? I know we talked a little bit about the reality that many people think more is provided than is. But what are the kinds of things that people are spending this money on? This $2 a day or $60 a month? What are these items?
I think it varies a lot. I mean, but when you think about it, some women still like to get their hair done,
Yeah.
Right.
so, and getting your hair cut is a $30 to $50 right there. We have to buy our own clothes. Or if you saw what I'm wearing right now, I'm wearing my dead neighbor's shirt, because when people die here, a lot of times their families leave the clothes. So we run a thrift shop every quarter from clothes that are donated.
Mhm.
So that's how we help so people don't have to buy clothes. Shoes, a good pair of sneakers is $50. That's
Yeah.
in New Jersey, that's a whole month. And, treating yourself for some candy, some Chinese food, a
Right.
pizza every so often,
Good
or,
call.
yeah, or if you want to go to a movie, I mean, that's extravagant. So those are some of the things that people spend their PNA on here.
Also, Ray, even like they provide soap and shampoo and lotion and
Mm-hmm.
and toothpaste, but are they the quality or type that you personally prefer? Even fragrance-free stuff, it doesn't always wear as well. So you end up spending a good part of your money on those items. Think about how much body wash costs and shampoo,
Well,
conditioner, and
yeah, and you're not really talking about, wanting high-end brands.
right.
We're talking about basic stuff like Crest toothpaste or like a VO5 body wash, basic things. I had a VO5 body wash I got from a church for Christmas, and I ran out 2 weeks ago. So they started using the stuff that the nursing home gives you. And my CNA poured it on the washcloth, and she kept pouring more because I couldn't get it to suds up.
Right.
That's how poor the quality is.
Yeah.
The other thing that I think is a real dignity issue is that many times nursing facilities will have events or will have outings, and that it's like, so if you're going to go out to one of the grocery stores, as an example, it's like the folks who have a low PNA or none can't participate in those activities, so that they're watching as other residents in the facility are leaving and doing things that they want to do, and they've got to stay home because they simply don't have a basic amount of money, discretionary money, to be able to spend on that. The other thing that hits me every time I hear this is that we all talk about person-centered care, and the reality is that and shampoo is a good example. The A lot of people have very distinct preferences on the kind of shampoo that they want, and it's not an extravagance, but it's like that's what they've been using for the last 40 years, and now all of a sudden they can't afford it.
Yeah, and I mean the next question I was going to ask, which really like sort of piggybacks on that, is what does it mean to residents when this amount is set so low? What are people missing out on? And I think, Bill, you just spoke to that quite well. And Jeanette, earlier, you talked about dignity and sort of what the PNA should be providing to people. I always think of the example, which is a very false example of, I have two kids. My daughter just turned 13 and my son is 10, and I give them an allowance every month. And they save some of it and they spend some of it on candy at CVS. But we provide them with everything else that they need. And I think people don't recognize that if you're living in a nursing home, this isn't just like extra money that's being thrown on top
Oh,
Right.
of everything. I mean, Ray, you talked about wearing, a deceased friend's shirt. So when you don't receive enough money, when you only have $30 and your hair is $50, getting your hair done, then you can't do it whenever you want.
Yeah, I
yeah,
mean, and that means a lot. And a lot of times we have to ask for help.
yeah,
And that can be pretty demoralizing at times. And if, people have families, they'll, see what other people want. So they'll bring in cookies, once a month when they come in so people can get some cookies, or they'll help people go shopping because you have to remember, we can't shop for the best prices, right?
right.
If we do go out, we're going to the store they take us to, or they're going to pick up from. So we're kind of locked into where they're shopping. So we can't go to two or three stores and wait for the best prices to come out and then go and take advantage of sales like people on the outside can.
Right.
Yeah.
And even if you order online, there's still like a delivery charge.
Mm-hmm.
So on top of the item, so you've got to plan for that as well, if you're able to do that. One thing my kids did this year is my son didn't like a pair of my sneakers I had. They were looking pretty worn. And so all my kids, I have three, all went in together and they all got me shoes for Christmas. So because they knew that I needed new shoes. So and I'm grateful I have that. But the reason I bring it up is there's a lot of people living or individuals living in facilities that have no family and they don't have
That's
people
right.
to pick up the extra, make up the extra when they see something is getting worn or needing to be replaced. That relies solely on the individual.
It was interesting. We were having an activity planning meeting earlier this week, and they said, okay, what do you want for bingo prizes? And the number one thing people ask for is shampoo, toothpaste,
Right.
body wash. Socks are a biggie because we
Yep.
don't get socks either.
Right.
So, if you want to wear shoes, you either have to use the sock things they give you, or you have to win your socks at bingo.
Right.
So I actually know one person here who doesn't even like playing bingo, but she needs the stuff, so she goes.
Right.
So to push clothing a little bit, we're talking about external clothing, or so far we're talking about external clothing. The thing that
Right.
really hit me was underwear.
Mm-hmm.
So for those people who are on Medicaid particularly and have no family, I mean, the external clothing doesn't match, but think about it in terms of would you like to wear donated underwear? Oh, and that is something that folks have to live with.
Well, think about being a woman and buying a bra.
Exactly.
A decent bra, you can blow a whole month's P&A
Oh yeah.
easily on something like that.
Easy, if not more so,
Mm-hmm.
if not more so.
Yeah.
And
Yeah.
and the facility here now, I do qualify, so I do wear like pull-ups. But some of our residents, if they didn't qualify Medicare, Medicaid, they have to pay for those themselves. Those alone can take almost all your P&A. It's not a cheap item.
Right.
Yeah, something else we've talked about internally at Consumer Voice quite a bit, especially as we see sort of the baby boomer generation entering long-term care, is cell phones and cell phone bills and the cost of maintaining a phone. And again, if you have a family and can be on a family plan and you enter with a phone, you're in one type of a situation. But if you're not in that situation, then the technology that people sort of depend on in their lives and are growing to depend on becomes a big problem.
Well, and there are nursing homes that make you pay for landlines.
Yeah.
So, there are places
Right.
that charge you $10+ to have a landline. And so that takes up a bunch of your P&A also.
Yeah. So, I wanted to talk a little bit about your states and what's been happening. I mentioned that half of all of states are providing less than $60 a month. The average amount in the US, if you consider those high states sort of pulling up the average a bit, is $69. But still, I think it's 25 states are providing less than $60. And in your particular states, I know efforts have been made to raise it. Some efforts have already been successful, some are in the middle. But I just kind of want to speak to that kind of the advocacy around this issue and what has been going on. And so, Bill, I will start with you because I think North Carolina has had their P&A raised to $70. So can you talk a little bit
Right.
about what's happened there and what you've done?
Sure, sure. So you had mentioned as you in the intro that there are two states that are still at the minimum personal needs allowance. There were four at the point we got ours raised to 70. So we were a state that had $30 set in, what was it, 72 that this is set up initially, and it had never been raised. So uh, it, it was on, so I belong to an advocacy organization uh, whose primary objective is to address the needs of residents in our nursing homes and assisted living facilities and quality of care kinds of issues. And we've had the personal needs allowance actually on our agenda for a long time. And we were first successful at getting it increased for, we have some Medicaid residents in assisted living facilities, and we were able to get that first. And then we used that as kind of leverage and also embarrassing our legislators to say we're in last place, um, to have our needs allowance actually increased to the $70 figure in the last session. So it's really been relatively new. It's only
Yeah,
been operationalized for the last calendar year. So and so now residents have that benefit. Well,
that's
it's been
great.
2 years now.
And Jeanette, can you talk a little bit about what's happened in Connecticut? Because I know you're now at $75, I believe.
We are. When I came into the facility, which is almost 17 years ago now, I've been a long-term resident. It was $69. And then there was some issues within our state with budgeting. So they came in and took $9 away from us and it gave us $60. 10 years, it took us 10 years, and it's been a few years now, where we advocated quite strongly legislatively with regards to increasing the P&A. And it ended up I think we asked for 70 or 72.50, something like that. And we were able to increase it to 75. But I worked on that project for like 7 years.
Wow.
One of the things we did was to get our legislation people to recognize the need to increase was we blew up big $2 bills, and we made them green, and we had the residents write on the back of them what they could buy for $2 a day. And we poured them I had all the nursing homes in Connecticut participate, and we poured them into legislative. And then when it came to term, they actually brought us up to 75. They voted in and agreed to it. What I'm currently working on right now is a campaign called the Cola campaign, and it's got a picture of a cola can on it, and it has a hand holding it, and it's referencing to let's pop the top and not leave our residents flat. Let's do a cost of living adjustment. Because when we did the increase from $60 to $75, one of the things we forgot to add in our legislative bill was the cost of living increase. So now we're going out, we're doing petitions. That's the campaign I'm working on currently at the state level, is having all our nursing homes, and we have 20,000 people living in Connecticut as individuals in long-term care. I think a little over 200 homes currently. Having each of them do a petition, have all their residents sign them, and we're submitting them with the hopes of getting the cost of living adjustment set into legislation, so that then as the cost of living increases within our state, that automatically will be adjusted. So we're at the beginning parts of the battle. We're doing the petitioning section of that component right now, but that is the goal. I'm hoping it doesn't take 7 years like the last time. But
yeah, I mean, that's a really good point about the cost of living adjustment, though, because, the federal P&A was last raised in 1987 from $25 to $30. And I believe that $30 adjusted for inflation in 2025 would be $82.37.
wow.
And there are so few states that come close to that right now. It's the cost of living aspect of all of this is really important. Ray, can you talk a little bit about what's been happening in New Jersey?
Sure, we're kind of in the middle right now. We actually, Stacey Moore worked with some of the legislators to write new bills in the Assembly and Senate. And we've mobilized our residents at nursing homes and their family members to sign petitions. We've sent them in. We've gotten through the first series of committees for the Assembly and for the Senate, and made it through unanimously being passed. A couple of weeks ago, we actually got a chance to meet with the governor's office.
That's awesome.
And so we got to meet with two of the directors at the Health and Human Services. We had policy people there, lawyers. So they had basically 10 people on the call, and there were 3 residents and 1 family member, and we got to tell our story. We got a half an hour. And what was really amazing about it is that even the people who should know this stuff don't know what a P&A really is. And some people in government still think we still get all our Social Security.
Right.
Right? Oh, that's not going away. But what we really tried to do is make it human. And that's what you did in Connecticut. $50 or $70, or what is it? What does that mean in today's dollars, right? And then it's not like your kid's allowance. What does it mean to us and our realities? We don't all have computers. We can't shop online. We don't have choices.
Right.
And so we really, I think, hopefully what helped is making it real to the people we're talking to. So we started doing some online media campaigns. So there's stuff we've done all different kinds of video clips that we're putting on different social media platforms to get the word out there. So we're trying to do a lot of education and grassroots efforts of bringing the residents and their families into it. And, caregivers are really key because they're the ones that are getting squeezed.
Yeah.
Right.
They see the quality of the products they get, right? They look at the food we get, which I don't know of any nursing home, and I know there are some that people think we get great food all the time and we get
Right.
great choices. Well, if you looked at our food, and we've had people here who've been in prison, they'll say they ate better in prison than they do in a nursing home. And I'm in one of the better homes in New Jersey. So we try to make it very human because, dollar figures are easy to say, oh, well, they're safe, right?
Right.
In a nursing home, they're getting, quote,
Yeah.
everything they need. So we have other things to focus on, but there's more to it than just the dollars. It's the human toll that goes into it.
Yeah.
Yeah, and I was just actually going to ask what you've all seen in your advocacy that has been working, and I think Ray, you just really spoke to that because at least for me, when I think about this issue, and it's the reason why two of you are living in long-term care and on this podcast right now, I really do think it is those personal stories and the things I've heard over the past year talking about this issues with people in long-term care that really resonates with people. And I think it's both, what you're saying in terms of there are some basic things you don't have that you want, but also it shouldn't matter. You should be able to have the shampoo or the toothpaste that you want because you're not asking for a shampoo that's $150. You're
Right.
trying to get something nice from CVS. And Jeanette, I think you made a point when you were talking about coffee. One of the times we talked about this issue before about getting a special kind of milk and how expensive it is and how you can't afford your coffee on the PNA. You can't afford a cup of coffee each day. And so I don't know if you want to speak to that for a minute, but to me that speaks to the dignity of this issue.
Right. And that's something that is, like you said, Ray, humanizing it. Everyone that I know either drinks coffee or tea. And if you were to, purchase it every day, I like almond milk. Well, now recently, Starbucks and Dunkin' Donuts have cut back and are no longer charging for different milks that they've just established that. But even so, my coffee is $3 or $3.65 a day. The kind of coffee, just a regular coffee with almond milk. That's what I was getting charged $4. So I couldn't even afford a basic cup of coffee every day on my PNA if I wanted one. And I think bringing that home to individuals, especially people in the Senate or legislatively, if you tell them, look, would you feel if you can't even have a good cup of coffee every day? I think some people go through the drive-through in the morning on the way to work and they spend more than that, $4 or $5 just to get a breakfast sandwich and a cup of coffee. And we as individuals who worked most of our life, I think deserve at least a good cup of coffee every day. And
Definitely.
I think that's a point people can relate to.
In this day and time, it is not hard to put together video clips of people talking about their personal experience.
Yeah.
And we were able to work with our ombudsman across the state. And they were basically taking their cell phones into facilities and they were asking if there were residents who would be willing to talk about their concerns, and they were recorded. And we used those. We got waivers, but we used those in our campaign. The other thing that we did was we had one particularly of a person who we slicked up a little bit. It was now it wasn't it wasn't a paid media campaign, but we did a little more intentional effort at it and put a little background music and that kind of stuff to it. And we used that when we went to the General Assembly on an advocacy day because people could have that on their phones, and when they were in offices, particularly talking with legislative assistants who really didn't understand this issue,
Yeah.
you basically pull out your phone and let the resident explain to them why this was an important issue for them.
I also think one thing that we found when we were doing it is some people don't want to go and be recorded because they don't want some of their old family and friends to know they're in a nursing home. There's still a lot of stigma
Right.
And
Right.
these people, we shouldn't feel bad about living in a nursing home, but then you're sitting here begging for more PNA, and even having to do this is kind of rough on you and
Yeah.
Right.
dehumanizing.
Yeah.
It's kind of insidious, but there's also a fear of retribution.
Yeah.
Yep, there really is.
If people don't want to make a wave because then they're afraid that
Yep.
the luxuries or what they consider luxuries already would be stripped from them,
Hmm.
like a whistleblower causing problems. I'm grateful I have really good support with my administration and most of the department heads here. If you give a suggestion, they work very hard to try to fulfill it, meet it, or find a way to make the necessary adjustment. But I'm very aware that I live in a very good home and it's not like that everywhere else.
So I was surprised the nursing home industry was actually an ally in this effort. They had been quiet about it, but we had some intentional meetings with them, and they eventually, not eventually, but they came on as supporters. Now, there's kind of a backdoor issue for them. Uh, the There are a number of these discretionary costs we're talking about that the nursing home eats. And so the part of their interest in coming to the table with us was that they've got the capacity now of charging residents for things that they were just donating. And, a part of that, it for us was awkward, but we still were able to get our personal needs allowance increased.
I mean, Ray, you mentioned something a few minutes ago that really struck me, and I think it sort of encapsulates a lot of what we're talking about. I think, whether it's a legislative aid or whether it's just somebody who isn't very familiar, even somebody who does know a lot about nursing homes, this idea of safety that people are sort of stored away and safe and you don't worry about them, and that in itself is so dehumanizing and takes
Yeah.
so much
Hmm.
dignity away from people. But I think that is a big part of many problems, but certainly of this issue, where again people just aren't cognizant of the fact that your needs are not all being met. And when you talked about getting Chinese food, or how when I talked, and I think Jeanette, both you and Ray were there when I had a conversation with some residents about what they spend their PNA on, many people, the first thing they said was food.
Right.
It wasn't all these other things, and some of that's because some people have family support, but it's because they want to eat decent food. And as a family that lives in a high cost of living city, my family, if we order out, very often makes a decision to order out from a location that's very close to us so we can run out and pick it up, because delivery fees alone, if you were to Uber Eats yourself a meal, that would take up pretty much your entire PNA in one evening. And so I think those are all things that are sort of tied together and that people aren't, they, they just don't think about, because again, they think you're there, you're safe, you're being clothed and fed, and you have a place to sleep, and so that's
Hmm.
it. But that's not all a human being wants or needs or should be entitled to.
Yeah, I find the people that I've told the PNA story to outside of the nursing home are shocked.
Sure.
Yeah.
And it's even, I'll just use an example of the church. The church comes here and does prayer groups and brings us gifts and stuff. And a couple of us actually go to church on Sunday. And, I'll talk about this stuff from other people to church. And they're just, in some ways, appalled, you know, by the PNA and how low it is. And then they're like, "Do you mind if we give you clothes?" And I'm like, "Bring over anything you have. We'll take it." We have no ego with wearing donated stuff, but yet people just don't understand. And we did a video, which you guys we did. I think it was on. Yeah, it was last year about for Residents' Rights Month, and it was what's behind the wall, because people drive past nursing homes all the time,
Right.
and they never want to know what's happening on the other side, and it really is surprising to people.
Yeah. So my last question, and again, we've spoken to this a little bit already, but what advice do you have for people, whether they're advocates, people who work on these issues, or whether they're people living in long-term care themselves, in taking up this issue? I mean, you've talked a lot about some of I think amazing work, that like grassroots type work that you've done, but it's also taking going to legislative offices and things like that. So what do you think has been most effective, and what advice would you give to somebody, a resident maybe, who's listening to this podcast and lives in a state where there haven't been many efforts around this yet?
I think getting to know your legislators in your region, having support from your administration if possible, but if not, then your state ombudsman's office. They are very good at supporting, finding out when the public hearings are, what the issues are. Do they, if you're not able to physically attend, do they allow you in your state to give written testimony or virtual testimony? I've done both this last year for several bills that are sitting in Connecticut. That's the way myself and others, individuals living in facilities, can really advocate for themselves, but also for their neighbors.
Yeah, I think also what we've done here is work with the activity directors or social workers.
Yeah.
Ask them to do, sometimes people can't call on the phone themselves, or they may not have the phone, but
Right.
can you set them up and do part of an activity where people call? You could dial the phone and let them leave a message for their legislator, right?
Mhm.
Let them write a letter, let them tell their story. And invite your legislators to come to your nursing homes.
Right.
That you let them say no, but it's better off that you have them say no than you not ask, right? There's nothing wrong with asking, and I think people are uncomfortable with doing it. But all these people out there with these high power teams behind them going out there and working on legislation, we're the silent, quiet ones.
Right.
If it wasn't for organizations like National Consumer Voice, who else is fighting for us? But the big lobbies have tons of people working for them. So your ombudsman is there, Consumer Voice is there, other such organizations are out there. But let your voice be heard in any way you can.
So this is a state issue in the sense of it takes a state legislative action to make a difference. And so we had worked on this for a long time, but we were not effective until a couple of things lined up. Uh, but the first one, and I would say it's the primary one, is to find a bill sponsor who can be captured by this as an issue. And that bill sponsor has to have enough political weight to be able to get this through whatever General Assembly you've got. This is frankly, in the grand scheme of things, is a sidebar issue. It is not something that commands much attention one way or another. So the reality is you've got to find an individual legislator who is willing to take this up and to use their credits to get this thing through. So that was probably the most important thing we did. We were able to capture a legislator. The second thing we did uh, was to get this on the radar with AARP. This was not something that they were paying any attention to. And we made a concerted effort as they went through their policymaking agenda to make sure that this thing bubbled up as one of their legislative priorities. And while it wasn't the primary focus for them, it was at least on the list. So, the thing that, we've got probably 400 to 500 people in our network. AARP and their lobbyists can come to the table and say, I represent 1 million people in the state of North Carolina. We can't do that. And having them involved in it made all the difference.
Great. Well,
Yeah,
thank you. Oh, go ahead.
I was gonna
Sorry.
say, kind of like what Ray had mentioned earlier, humanizing it. A lot of the senators and legislators either have family or at ages now where they have family that they're caring for, or they themselves know or have loved ones that they may having to be put into a nursing facility. And I just would remind them that it doesn't just affect your loved ones, but someday it may affect you individually as well. No one plans. I didn't wake up at 44 and say, gee, I want to go live in a nursing home today. I don't think any of us ever planned for that for our lives, but we've learned to adjust and settle in and then advocate and work to maintain some formal way of life for ourselves that's beneficial and not wasted. I guess that's the word I'm trying to say. Where I don't think individuals living in what I want to call the outside world really recognize the need for until it affects them personally. And I think making people to wake up and be aware of what is happening and just keeping at it will hopefully affect the long goal in the end.
And when you do think about it, it's not a lot of money in a state budget to increase our P&A.
No.
It's really a rounding error. So it should be easier than it is, because it's not a lot of money, but it's so important.
It is.
Yeah. Well,
It's
I think
life-changing for many individuals.
Yep.
Yeah, I think that's a good place to sort of end this. And I mean, just kind of to reiterate, like you do need to have, as Bill, you pointed out, the political, systems in place to make this work, but the education so that people know what we're talking about, and then really the humanization that goes along with that, and making people understand, Jeanette, as you pointed out, that this could be their grandmother, this could be their aunt, this could be their neighbor, but it also could be them. Really does in all the advocacy that we do at Consumer Voice, I think that's our superpower, is really having that ability to say, like, people who live in long-term care aren't any different from people who don't live in long-term care. It's just, it's where you live, and what your circumstances have been. So I think this has been really helpful, and I appreciate you all being here today. So thank you so much.
Thank you for having us.
We appreciate it.
Thanks for joining us on Pursuing Quality Long-Term Care. This podcast is a program of the National Consumer Voice for Quality Long-Term Care. Consumer Voice is a nonprofit organization and depends on our members and donors for support. To contribute to this podcast and our work, make a donation at theconsumervoice.org/donate. Every dollar helps. And make sure to visit our website, theconsumervoice.org/pursuingquality, where you can subscribe to the podcast, follow us on social media, and find more information and resources. If you enjoy the podcast, please rate, review, and subscribe. Thanks for listening, and we'll see you next episode.